We all have those little annoyances, aches, pains, and random tingles we shrug off like they're nothing. But what if those minor discomforts are actually your body's way of saying, hey, something's off here? Ignoring them could lead to bigger problems, and nobody wants that. From chest pain to hair loss, and no, it's not just stress. These signs could be a red flag. So let's break it down and talk about why you shouldn't ignore these little warning signals before your body sends you a more dramatic message. Number 8. Chest pain. Chest pain is a serious symptom that can indicate heart disease, one of the leading causes of death globally. It often feels sharp or like a heavy weight on the chest, sometimes radiating to the back, arms, jaw, or neck. While chest pain is commonly linked to heart attacks due to artery blockages, it can also result from conditions like acid reflux or muscle strain. If chest pain occurs frequently or worsens, seeking medical attention is vital. Accompanied by symptoms like shortness of breath, nausea, dizziness, or pain radiating down the left arm, immediate action is essential. Prompt diagnosis and treatment can significantly improve survival chances and prevent complications like heart failure or death. Number 7. Hair loss. Hair loss is often seen as a cosmetic concern, but when it happens suddenly or excessively, it may indicate underlying health issues. While it's normal to lose some hair every day, a noticeable thinning or patchy baldness could be a red flag. Many people experience hair thinning as they age, but significant or sudden hair loss may be a sign of stress, hormonal imbalance, nutritional deficiencies, or chronic health conditions. For instance, hypothyroidism, which occurs when the thyroid doesn't produce enough hormones, can lead to hair loss. Similarly, anemia, which is caused by low iron levels, can also result in thinning hair. A more serious condition, like an autoimmune disorder, can trigger hair loss as well. In fact, certain heart diseases have also been linked to hair thinning, especially if they are associated with poor circulation or high cholesterol. If your hair is falling out more than usual or if you notice bald patches, it's important to seek medical advice. Addressing the root cause of hair loss early can prevent it from worsening and, in many cases, reverse the damage. Number 6. Tearing sensation. Experiencing a sudden and severe tearing or ripping sensation in your back, chest, or abdomen should not be ignored. This type of pain is often linked to an aortic rupture, a life-threatening condition that occurs when the aorta, the main artery that carries blood from the heart, tears. The pain from an aortic rupture is often described as sharp, intense, and unbearable, and it can radiate from the chest to the back. An aortic rupture is usually caused by trauma or damage to the aorta, such as from a car accident or a fall, but it can also result from chronic conditions like high blood pressure or atherosclerosis, which weakens the artery walls over time. This condition can lead to massive internal bleeding, and without immediate surgical intervention, it's often fatal. If you feel this type of sudden, severe pain, especially if it's accompanied by dizziness or difficulty breathing, you must seek emergency medical care right away. Number 5. Dizziness. Dizziness is a common symptom, but when it occurs frequently or is accompanied by other warning signs, it could indicate something far more serious. Often, dizziness is described as feeling lightheaded, unsteady, or like the room is spinning. While some cases of dizziness are benign and related to dehydration, standing up too quickly, or a change in posture, it can also be a sign of more severe conditions like heart disease or stroke. One of the most common causes of dizziness is low blood pressure, which occurs when your blood flow is insufficient to maintain balance and proper oxygen levels in your body. Another common cause is anemia, where a lack of iron leads to a shortage of red blood cells, causing dizziness and fatigue. Dizziness can also be a sign of cardiovascular problems like arrhythmia, where the heart beats irregularly and affects blood circulation. If dizziness is frequent or severe, or if it's accompanied by shortness of breath, confusion, or difficulty walking, you should see a doctor immediately. This symptom is especially concerning if you have a history of heart disease or if you experience sudden fainting or weakness. Number 4. Numbness. Numbness, particularly if it affects one side of the body, should never be dismissed. Sudden numbness or weakness in your face, arm, or leg could be a sign of a stroke. Stroke symptoms typically appear suddenly and are often accompanied by other warning signs, such as confusion, difficulty speaking, and vision problems. A stroke occurs when the blood supply to part of the brain is interrupted, which can result in permanent brain damage if not treated quickly. Numbness that comes on suddenly and is persistent or accompanied by other symptoms, such as slurred speech or a drooping face, requires immediate medical attention. Numbness can also indicate other health conditions, such as multiple sclerosis or diabetic neuropathy. In cases of multiple sclerosis, the immune system attacks the protective covering of nerve fibers, causing numbness, tingling, and weakness in the limbs. Diabetic neuropathy, a common complication of diabetes, occurs when high blood sugar damages nerves, leading to numbness and tingling, particularly in the hands and feet. If you experience unexplained or persistent numbness, it's important to seek medical evaluation to determine the cause and begin appropriate treatment. Number 3. Tingling. Tingling, or a pins and needles sensation, especially in the hands, feet, or legs, is a common symptom that often goes unnoticed. However, persistent or widespread tingling can signal a number of health conditions, many of which involve nerve damage or poor circulation. Conditions like diabetes, multiple sclerosis, and carpal tunnel syndrome can lead to nerve compression and cause tingling sensations in the extremities. When nerves are compressed or damaged, they can transmit abnormal signals to the brain, resulting in a tingling or burning sensation. Poor circulation, often caused by conditions like peripheral artery disease or atherosclerosis, can also lead to tingling. When blood flow is reduced to the extremities, it can cause numbness and a tingling feeling. If tingling persists or is accompanied by other symptoms such as weakness, pain, or difficulty moving, it is essential to seek medical advice. Early intervention can help prevent the condition from worsening and reduce the risk of permanent nerve damage. Number 2. Sweating. Excessive or unexplained sweating, particularly when not related to physical activity or hot weather, can be an indication of a more serious health issue. Sweating is the body's natural way of cooling itself, but when it occurs excessively and without a clear cause, it can signal underlying problems. One of the most common causes of abnormal sweating is hyperthyroidism, where the thyroid gland overproduces hormones that speed up metabolism and increase body temperature. This leads to excessive sweating, especially in the hands, feet, and face. Other potential causes include heart disease, where excessive sweating can occur during a heart attack, or as a result of chronic heart failure or menopause, where hormonal changes cause hot flashes and night sweats. If sweating is accompanied by chest pain, shortness of breath, or fatigue, it could indicate heart-related issues and should be evaluated by a doctor. If the sweating is persistent or interfering with daily life, it's important to consult a healthcare provider to rule out any serious conditions. Number 1. Swelling. Swelling, especially when it occurs suddenly or in unusual areas of the body, can be a sign of poor circulation or underlying medical conditions. While swelling is common after physical exertion or injury, unexplained swelling in the legs, ankles, or feet could indicate more serious health issues, such as heart disease, kidney problems, or even deep vein thrombosis. Swelling occurs when fluid builds up in the tissues, and this can happen when the body is unable to circulate blood effectively. For example, in heart failure, the heart is unable to pump blood efficiently, causing fluid to accumulate in the lower extremities. Similarly, kidney disease can lead to the body's inability to eliminate excess fluid, resulting in swelling. In cases of deep vein thrombosis, a blood clot forms in the deep veins of the legs, causing swelling and pain. If you notice unexplained swelling, especially if it's accompanied by pain, redness, or warmth, seek medical attention promptly. Early diagnosis and treatment can help prevent complications and improve outcomes. That's all for today's video. If you found this video helpful, don't just sit there, smash that like button and subscribe for more future videos. Got any burning questions or hilarious health moments to share? Drop them in the comments. Thanks for watching, and remember, your body's not a mystery, it's just really bad at texting. See you in the next video.